Tonight, we begin with a development that Social Security officials had feared, dismissed, and then scrambled to prepare for, all at once. A decision that unfolded not over years, not over months, but in a single legislative session. A single session that changed the income floor for millions of disabled Americans. A single session that quietly rewrote the rules seniors had been living under for decades. A single session that put real money, over $300 per month, now officially active and in motion on SSDI. What Congress and the SSA did this cycle crossed a threshold that budget hawks had hoped would hold. And when that threshold broke, advocates did not hesitate. They responded with clarity, with urgency, and with the kind of organized pressure that Washington rarely ignores. For years now, there had been signals, not press releases, not formal announcements, just signals, that the Social Security Administration was preparing something significant. The SSA has been cautious, yes, but they have been persistent in their caution. Their moves have followed a certain rhythm, a pattern, almost a discipline. But what set off alarms inside senior advocacy circles this cycle was that the pattern changed. Experts who monitor disability benefit structures know the indicators. The quiet reviews of the substantial gainful activity thresholds. The internal actuarial recalculations tied to cost of living pressures. The congressional hearings on adequacy of disability payments. The sudden silence from lobbyists who usually push back hard, all of that went quiet. And whenever Washington goes quiet on Social Security, it means something is about to get loud. Early this year, the Social Security Administration confirmed what analysts described as a meaningful recalibration of SSDI benefit structures, including cost of living adjustments and income thresholds that had not been revisited in over a decade in any substantive way. These are the kinds of policy moves that the SSA only makes when they are signaling something very specific, either a recognition that current benefits are inadequate, a response to sustained political pressure, or a structural correction long overdue. Observers didn't know which category this would fall into, or whether it fell into all three at once. But what they did know was that the SSA was changing its posture on SSDI adequacy. And when a federal agency shifts its posture without a headline moment attached, even by a small measure, advocates and beneficiaries pay very close attention. The statement issued by senior policymakers this month was not normal. It was not routine. It was not symbolic. It was substantive. Source after source described the new SSDI benefit baseline as long overdue, structurally sound, and perhaps most importantly, enforceable in a way previous adjustments never were, but policy only works if the beneficiaries know about it. Advocates and senior organizations did not hesitate. In fact, their response in getting information out to the public was among the most coordinated we've seen in years around disability benefit news. Here's what we know. Within weeks of the official confirmation, senior advocacy networks began publishing guidance. These weren't the usual vague FAQ sheets. These were detailed, step-by-step breakdowns, materials that beneficiaries only receive when the change is large enough to affect how they live. Tonight, confirmed sources report that the new SSDI monthly benefit floor now exceeds $2,300 for qualifying recipients, including workers with significant disability histories who had recently been flagged under long-term maintenance reviews for what analysts believe was benefit recalibration. The SSA moved before confusion could take hold. They updated their online portals. They notified state agencies. They issued direct correspondence to beneficiaries already in the system. They hit the information gap head-on. They addressed the eligibility confusion directly. They targeted the documentation backlog that had been quietly building for years. In other words, the SSA targeted the structural weaknesses in the delivery system itself, not just the payment amount, the infrastructure that would have made the benefit increase meaningless if people didn't know how to claim it. This is what made advocates' response so urgent. The SSDI increase wasn't just symbolic, it was actionable. It represented the kind of policy shift that could genuinely change the monthly financial reality for millions of seniors if fully implemented. And the agencies involved, understanding that fully, responded with precision. Not slowly, not bureaucratically, but with real coordination. They didn't rush through paperwork checks. They didn't bury the update in regulatory language. They updated benefit tables. They clarified eligibility language. And here's where this story becomes even more significant. Policy analysts now believe that the SSDI recalibration was designed to test the administrative capacity of the SSA after years of underfunding and understaffing. Lawmakers wanted to see whether the agency could absorb a significant benefit increase and deliver it consistently without creating a backlog that would erode public trust. But instead of stumbling, the opposite happened. The SSA didn't collapse under the administrative weight. They responded with a delivery effort that was so methodical, so structured, that even critics of the agency's pace noticed. You don't get Washington's attention on Social Security Administration easily. But this cycle, the SSA earned it. Analysts speaking with policy publications under background-only terms described the SSA's operational shift as a recalibration, a way to rebuild credibility with the tens of millions who depend on SSDI for basic survival. And the agency proved today that they remain both capable and determined. Their actions were not only administratively sound, they were timed so precisely that benefit letters went out before most media outlets had even reported on the change. That timing matters because it shows something important. The SSA is not playing defense. They are operating with proactive intent. They are moving ahead of the news cycle, not behind it. As reports continued coming in throughout the week, we learned more about the scale of this change. State-level Medicaid offices coordinated with the SSA to ensure that the SSDI increase did not inadvertently trigger benefit clawbacks under means-tested programs. Disability rights organizations targeted outreach toward recipients who had been in appeals processes in the last 18 months and may not have received updated benefit guidance. Independent case managers operating across rural communities reportedly distributed printed benefit summaries used by recipients who lack reliable internet access to verify their new monthly amounts. This wasn't just a payment increase. This wasn't just a policy update buried in a federal register. This was a system-wide recalibration. This was a credibility test. And credibility is the one thing the Social Security Administration has struggled to maintain since the pandemic-era service disruptions that left millions of seniors without consistent access to caseworkers. For every setback they have weathered, advocates have countered with something that keeps public pressure squarely on full implementation. Remember, critics thought SSDI benefit floors would stay frozen indefinitely under fiscal pressure. They thought the cost of living adjustments would be symbolic, too small to change how recipients actually live. They thought the disability community lacked the political organization to push for substantive reform. But tonight, the exact opposite is happening. Benefit floors are rising in real, measurable dollars, past the $100 to $300 per month threshold that advocates have cited as the floor for basic dignity. Cost of living adjustments are landing in bank accounts, not just in policy documents, and the disability community has demonstrated exactly the kind of organized, sustained political presence that turns skepticism into signed policy. What makes this moment so critical and so urgent for individual beneficiaries is that the SSDI increase happened at a time when millions of recipients are under compounding financial pressure. Renters want protection from eviction while on fixed incomes. Prescription drug users want relief from out-of-pocket costs that eat into every benefit dollar. Caregivers want recognition that SSDI recipients often support entire households, not just themselves, and working-age adults with disabilities want assurance that returning to part-time work won't trigger benefit termination. Beneficiaries are balancing these pressures while managing health conditions that make financial unpredictability especially dangerous. And when a benefit floor is set too low during that kind of sustained pressure, recipients don't just struggle. They make impossible trade-offs between medication, food, and housing. That is the reality that makes this 300-plus threshold not a talking point, but a lifeline. The SSA's formal notification, now distributed through multiple channels including mail, online portals, and state agency partners, was designed to signal that the federal government is not willing to allow a benefit increase to go unclaimed by those who qualify. Officials said plainly that outdated benefit tables were inconsistent with the current cost of living reality faced by disability recipients. That is careful language for, "We got this wrong for too long and we're correcting it now." You don't usually hear that tone from federal agencies unless political and advocacy pressure has reached a point where acknowledgement is not optional. Meanwhile, advocates at the forefront of the SSDI adjustment push addressed their communities in clear, direct communications this week. They said, "This increase is real, it is confirmed, and it belongs to you. Do not let it go unclaimed." They said, "Check your benefit statement. If your monthly amount does not reflect the updated figures, contact the SSA immediately and document every interaction." And they said, "This is what years of organized advocacy produce, not promises, but payments." These are not rhetorical flourishes. These are statements from organizations that understand exactly how high the stakes are for the people reading them. People who have waited years for a benefit structure that reflects the real cost of living with a disability in America. Here's what makes the situation even more consequential. The SSDI increase wasn't isolated. Along with the primary benefit floor adjustment, Medicare premium coordination reviews were also updated to ensure the benefit increase is not fully absorbed by premium deductions. Supplemental security income reviews were cross-referenced to identify recipients who may now qualify for both programs simultaneously. Work incentive programs increased their outreach targeting recipients who previously avoided part-time employment out of fear of losing full disability eligibility. All of this happened within the same policy cycle. When multiple benefit systems move together, it means something larger is underway, a structural commitment, not a one-time adjustment. Analysts are now considering several possibilities for what comes next. One is that Congress is preparing to codify the 1,300-plus floor as a permanent statutory minimum, removing it from the annual adjustment process and locking it into law. Another is that the SSA is attempting to build public trust ahead of a larger Social Security solvency debate, using demonstrated benefit delivery as evidence of administrative competence. A third possibility, the one that has advocates most focused, is that this is an opening move in a longer campaign to raise the substantial gainful activity threshold and reform the work penalty structure that has kept millions of disabled Americans from returning to employment. But today, the benefit increase took one card off the table: the argument that SSDI is structurally incapable of delivering meaningful support. They didn't offer a pilot program. They didn't create a wait list. They didn't issue a study. They issued checks. What we're watching now is a test of institutional follow-through. The federal government wants to demonstrate that Social Security can adapt to economic reality without legislative gridlock. Beneficiaries want to see that this increase survives the next budget cycle intact. Advocacy organizations want to prevent any future COLA calculation from being quietly adjusted in ways that erode the real value of the $1,300 floor. And fiscal watchdogs want to prevent long-term solvency risk from being used as justification to roll back what was just granted. Tonight, we've heard from caseworkers and disability law specialists who are now closely monitoring benefit statement issuances. They say the rollout has been more consistent than prior COLA implementations. They say recipients who haven't yet received updated statements should call 1-800-772-1213. the SSA's main line, and specifically reference the 2024-2025 benefit recalibration. And they say the SSA's decision to issue proactive written notifications is likely part of a broader effort to reduce the administrative backlog of benefit appeals that has plagued the agency for years. But advocates are not standing down. In fact, they are accelerating their outreach. Their response, organized, transparent, and persistent, has sent a message to the SSA that the disability community will verify every dollar and challenge every shortfall. And it sent a message to policymakers that the beneficiaries who depend on SSDI are paying close attention and will hold every institution accountable. As the coming months unfold, we expect more details to emerge about how exactly this benefit increase will interact with state-level programs, tax thresholds, and Medicare coordination. But what we do know is that the SSA's action was timely. It moved before the cost of living gap grew wider. It moved before another year of benefit erosion compounded the hardship already carried by millions of disabled Americans. And it moved with enough transparency that recipients, for once, didn't have to piece together the news from fragments. What happens next will depend on what Congress does in the next budget session. If they codify this floor into permanent law, this moment will be remembered as the turning point where SSDI became genuinely adequate. If political pressure reverses course, advocates have already shown they are organized, vocal, and ready to respond. They have shown they are prepared to protect what was just won. And tonight, for the first time in years, the agencies that manage Social Security appear to be listening. Washington is quiet on the usual objections. Too quiet. And when the opposition goes quiet, it means they are calculating their next move very carefully. Because tonight, the SSA and its advocates demonstrated something that critics of the disability benefit system have resisted acknowledging for a long time. The people who rely on SSDI are not passive recipients. They are citizens who vote, organize, and remember. The benefit floor is not a ceiling. It is a foundation, and it can be raised. And the political will to protect Social Security is not gone. It has simply been waiting for the right moment to make itself heard. This story is far from over. But tonight, one thing is clear. The 1,300-plus monthly benchmark on SSDI is now active, confirmed, and in motion. The advocates who fought for it are not standing down, and the millions of Americans who depend on it have one more reason to hold this system accountable, and to make sure every dollar they are owed finds its way into their hands. And we will be here, watching every detail as the next phase of this fight unfolds.